This is Dr. Ron Pearl. I'm chair of the Department of Anesthesiology, Perioperative and Pain Medicine at Stanford University. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Ronald Pearl, chair of anesthesiology at Stanford. Doc, how are we doing today?
Good. It's a pleasure to be here.
Thank you for being with us. Getting started, what were your goals and aspirations during your residency, and how have those changed throughout your fellowship?
So it goes back really to college and medical school, when in my mind I decided that I was interested in an academic career which would combine clinical care of patients, because that was always critically important to me and why I went into medicine, with research to advance the field. As a resident, my focus was really on the clinical care aspects of becoming the best physician I could be. But there was always during that time the plan that I would be going on in an academic position and having that standard combination of clinical care, education, and research going on. My path was a little different in that I first did internal medicine residency and critical care fellowship, and spent some years on the faculty in medicine before going and doing a second residency in anesthesiology. But the goal of all of that time was always to go ahead and have that sort of a triple threat presence.
So taking us through that last year, what was your mentality getting into your first job search, and how that perspective changed in the beginning years of your career?
So like many people, I think through most of my training, I did not give much thought at all to a job search at the end of it. It was always that will be the year that I need to go and find a job is when I will do that. I was fortunate in that from residency, I stayed and was able to do a fellowship, and during fellowship was offered a faculty position, and so there was what I wanted. So at that point, there really was no job search involved. This was when I finished my first fellowship. But afterwards, at different times, I did question, is this really the position I want? So there was some job search at that point in time. For me, a critical aspect in terms of a job search was really spending a lot of time thinking, what is it that I really want out of a job? What are the aspects of it which are important? To what extent is being in academics critical to me? What is the mixture of activities I want in a position? Do I want a job which is 80% research, a job which is 80% clinical, one which is more 50-50? And then what are the potential opportunities to achieve that? And for me, being already at Stanford, were there places that would offer me a better option than what I had here? In the end, I decided that with the change from internal medicine to anesthesiology, I could accomplish everything I wanted, and fortunately, that's turned out to be accurate.
Can you briefly take us through your journey and how you became the chair of the anesthesiology program?
Yes. I think there are many people whose goal is to be a chair of a department. I have to say that was never really my goal at all. I was pretty busy between doing anesthesia in the operating room, doing critical care in the ICU, teaching and research, that I was not at all thinking about wanting to be a chair. I think a important aspect in all of this is sort of serendipity, that as opportunities come along, you make the best use of those opportunities. In my case, a critical aspect of it was I've always been interested in finance, and ended up to be vice chair for finance in the department, which was not a particularly major role, but the department did have financial challenges at this point, when basically all anesthesia departments throughout the country were under significant financial stress. I, at the request of the department chair, wrote a sort of white paper for the dean in terms of what we needed to do to solve those financial issues, and I think that got me some level of recognition. When the chair at that point basically was asked to resign, and they did a search, I therefore was a candidate. I never really, again, thought that that was something I would want to do, but as I saw the other candidates, decided that I felt it was important to the department for me to consider being a candidate for chair, because I thought the culture we had was one that was important to preserve and was somewhat unique here. So I became a candidate for the search for a new chair at that time. So I would say I didn't really know what being a chair would be like. There was a lot of surprises afterwards, and as I talk to new chairs, that's commonly the story. Most people, until you're in that role, you don't really understand how you spend all of your time, but it's been a great experience for me.
So, kind of on that mindset, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks of the academic world?
So, before being chair, I think a critical aspect of this is always relationships and networking and people, and basically, establishing yourself as someone that people can rely on, who's reasonable, can provide advice, someone who has at the heart of medicine is always commitment to patient care, and is thought of as an outstanding physician. I think also someone who's capable of thinking broadly, having a vision that is not simply taking care of things on a day-to-day basis, but has gotten involved in different areas, whether that's in your department, in your hospital, in your community, and has sort of the respect of people around you has been important. I think, again, both making the best use of opportunities as they come along, but also being recognized as someone who's being willing to put the work in to solve problems is important. The advancing in the academic ranks is something that just in one sense occurs when you're doing your job correctly. The research part of it for where I was also important. And again, it was the same thing, that as new ideas came along, going ahead and doing what you could to adopt them, to staying in front of where the field is and being a leader in that field, and getting recognition. Important is, going to meetings and networking, and so you get recognized. This was in the days before social media, but nowadays, if I was advising people, social media is a critical aspect of that level of recognition. I think the other critical aspect of it is mentorship, and I was fortunate to have a incredible mentor. And as we talk about nowadays, it's not just mentorship, which, for want of a better term, is telling people what to do, but also sponsorship. So a mentor who goes and introduces you to the right people, who gets you speaking engagements, who tells people about the great job that you're doing, and does things like gets you on the right committees, and as well tells you how to progress your career in terms of the things you should be doing.
Now, as the chair of the program, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
So if I step back and sort of think about, again, what it is that people are looking for in jobs, they should spend a lot of time introspectively in terms of what do they want out of a job. Do they want an academic job that involves research? Do they want a job which is clinical care and teaching? Do they want a private practice job? They should think some about what sort of practice setting do they want. Do they want to be, in a big city? Do they want to be in a more suburban or rural area? Do they want to join a group which is a very, very large group? Do they want to be in solo practice on the other hand? As part of a group, do they want a culture where people are sort of independent versus, a call schedule where you're not taking care of your patients on call? That's done by whoever the call person is. Do they want to join a group where the expectation is you work 40 hours a week, or where the expectation is you work 80 hours a week? And to really get an idea of that aspect. For many people, geography is also going to be a critical thing. Are they needing to be somewhere because of a partner or family? Do they want to go somewhere they've never been? Do they want to try and stay where they are? So I think before they start thinking about jobs, they should really figure out what is the job that they want and where do they want to find that job. I think in most places they will have an opportunity to speak to a lot of people where they are training and find out from them their experience. Most people have not been at their institution forever. Many of them have had experience with other jobs, and they will get, I would say, a relatively consistent story about what works and does not work in a job, and importantly is to really know the people you're going to be working with, what their expectations are and what your expectations are, and be sure that there really is a good match. When they get to looking for a job, most people end up finding a job by personal interaction, that someone in your program knows someone where you want to go, and they make that introduction is critical, or you already know that place and you have that introduction, or at a minimum, when you send a CV and a cover letter, that you communicate why is it that you really want to be part of this group, so that they know something about you and what you're looking for. Because if there's not that real match of what your goals and expectations are and the groups, you end up there, and several years later you find out that that neither side is particularly happy. You may be doing a great job, but you're not happy, and you're not going to stay there with that group.
So as we were dealing with the pandemic in 2020, now in 2021, what advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
Yes. So COVID-19 has made this entire process much more challenging. Interviews are often virtual. You don't get to go out to dinner with the people in the group. You don't get to sit down and really see what they're like. I think, like most things with COVID, it's to do the best you can. To get very good at how you communicate on Zoom. I think most of these will be Zoom interviews, and to be prepared beforehand. So to know what information you want to get out of that meeting, and to know what you want to communicate as part of that. Again, because there's less direct interaction, having your CV resume be perfect is important. And most people, when you send something, what they really focus on is your cover letter, and being sure, again, it's clear about what is it that you are bringing, but also what is it that you think that you really want to see in the group that you're going to be joining. And I think that equally applies almost anywhere you're looking for, in academics, in community practice. Also, again, understand what it is that they're looking for and how you are going to help them fulfill it. I think when you take, before you take a job, yes, you almost definitely have to go and interview in person. It's the only way they will really know you, and that you will know them, and that's absolutely critical. I would say that almost all of the stories I know of where people took a job and it didn't work out, when you talk to those people, they recognize that they could have figured this out before they ever took the job. And there's a lot of enthusiasm and excitement, and people like to imagine, yes, everything's going to be perfect. I don't really have to know what I'm getting into beforehand. And I think you both should know what it is that's actually the expectation, but also get the opportunity to really meet with the people you're going to be working with, and get a feeling that it's the right match.
Being the leader of the program, what are you looking for when you're interviewing medical students for resident spots and also residents for fellowship spots?
Yes, so it's much easier interviewing medical students for residency, because we have great information about them. We're looking for people who have clearly excelled academically, and nowadays we're able to get that from basically their medical school record. For us, we put the larger focus on their clinical clerkships. I know many specialties focus a lot on their clerkship in their own area. For anesthesiology, that for us has been less important, because those clerkships tend to be shorter. And our sense is that we don't really get great information, because the role of an anesthesia resident is very different than the role of a medical student on anesthesia rotation, but we are very concerned of how have they done during that period of time. We're also looking for people who basically are interesting, and are interested. So we very much look at what volunteer and leadership activities have they been involved in. It also tells us whether they basically have bandwidth to do things. And the person who did really well academically but spent all of that time simply doing that is obviously not as strong as the candidate who did really well academically but also was able to do multiple other activities, particularly at a leadership level. We are interested in people who will be leaders, and a lot of that, again, comes from looking at their activities, but also what are their career goals. So when I interview people, I often, ask the question, 10 years from now, tell me what your life is going to look like. And you learn a lot from that question, and we want people who in some way will be leaders. Lots of different ways of doing that. They may be leaders in their clinical group, in their hospital, in their community, in global health, in organized medicine. But they're all people who are going to do more than just be good physicians. They're going to be people that, we want to, on our annual magazine that we put out, where we feature, people, we're not featuring people because they were great clinicians. We're featuring them because they've done other things. So we're looking at that. And then, a lot comes down to the interview process. People who are articulate, who are clearly deep thinkers, who we think will clearly be committed to residency, which is hard work, and to the goals that we want them to achieve in their lives. This year was interesting as you talk about COVID and Zoom. We felt that we were able to get the exact same interview information as we did when people were there in person. Again, with technology, but also with thinking about in advance, we are able to really get a good conversation going and getting to know people during that time. When we think about fellows, people who have done residency, as I said, it's actually more challenging because at least in our specialty, we don't get much information about how people did during residency. The letters of recommendation provide very little information to us. Everyone's always has great letters of recommendation. There is no grading system. We do look at USML at activities that they did during residency, but during residency, it takes a lot of focus, and so many people have not done a lot during residency. We have anesthesiology is a large specialty. We match 30 people a year, and so we're interviewing significantly more than 30. You can't make a lot of personal contacts to other programs as you might in a small specialty where you can call up the residency program director and ask about an individual. So we do struggle with it in that there's less information, but for fellowship, for residency, we can't call all the places, but for fellowship, the numbers are smaller. So most of our fellowships are 6 people, and our fellowship program directors know all the fellowship program directors at other places, and so we will frequently make those phone calls. How did this person really do in residency? There is a move towards a formal program director letter that is comparative in many specialties, and we do see some of that for our fellowships. Those can be very effective, particularly if we know what sort of letters that person writes and can trust that when they say this person is in the top part of the residency class, that they truly were in that category.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.